Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Arixtra. Introduction. Arixtra, or fondaparinux sodium, is a medication that helps prevent blood clots from forming or getting larger in the deep veins of the legs and thighs and possibly the lungs. Arixtra is injected through shots in the fat layer under the skin. You may be asked to give yourself injections of Arixtra to keep injections on scheduled times. This program explains how to use Arixtra safely. It also discusses signs you should look for while you are being treated with Arixtra. Blood clots. When a person gets injured, the wound bleeds. Blood has substances that help it to clot, causing the bleeding to stop. This clotting happens after skin injuries as well as after injuries inside the body. Sometimes the body forms clots inside the blood vessels. If a clot moves to a narrower blood vessel, it will block the flow of blood. The part of the body that is fed by the blocked blood vessel could die if blood flow is not restored. Blood clots can be very harmful. They can cause a heart attack if they block a blood vessel in the heart, a stroke if they block a blood vessel in the brain, shortness of breath, or a failure of respiration if they move to the lungs. Blood clots are more likely to form if a person is lying down in bed after surgery. They can also form after a stroke, heart attack, angina, and other medical conditions. Patients with some types of cancers are at an increased risk of developing blood clots. Smokers and women on birth control pills are also at an increased risk of developing blood clots in their blood vessels. To prevent blood clots from happening, your healthcare provider may prescribe medications that thin the blood. The blood of patients on such medications takes longer to clot. These medications are called blood thinner medications. Arixtra is one type of such blood thinning medications. It is also called fondaparinux sodium. Arixtra. Arixtra is given through an injection in the skin. The medication is administered in the fat layer under the skin. This is called subcutaneous injection. Subcutaneous means under the skin. Your healthcare provider will tell you how much Arixtra you should inject. This is called dosage. Follow the dosage prescribed by your healthcare provider. Do not miss a dose. If you miss a dose, inject it as soon as you remember it and it is within a few hours of the supposed injection time. However, if it is almost time for the next dose, skip the missed dose and continue your regular dosing as scheduled. Do not double the dose. Tell your healthcare provider what prescription and non-prescription medications you are taking. Tell your healthcare provider if you take blood thinners, aspirin, or other non-steroidal anti-inflammatory drugs such as ibuprofen or naproxen sodium. Tell your healthcare provider if you are taking herbal supplements. Tell your healthcare provider if you have bleeding problems, any recent bleeding, or if you bleed easily, high blood pressure, a recent stomach ulcer, eye problems due to diabetes, kidney problems, or had a stroke. Tell your healthcare provider if you are pregnant, plan to become pregnant, or are breastfeeding. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. The syringe. Arixtra comes pre-filled in syringes that have the exact amount prescribed for you. When you receive your Arixtra syringes, check the medication name, dosage, and expiration date. Do not use the syringe if it is expired. Look at the syringe before using it for cracks or leaks. Check that the color is clear. Do not use the syringe if the Arixtra solution is discolored or if it contains particles. Store pre-filled Arixtra syringes at room temperature, which is between 59 degrees and 86 degrees Fahrenheit. Keep the syringes in a clear storage bag or cupboard so they do not get wet, lost, or damaged. Keep out of the reach of children and pets. Injection procedures. Your healthcare provider will teach you how to give yourself the shot. This section reviews how to inject yourself with Arixtra in the stomach area. Select a room to give yourself the shot. Pick a clean, uncluttered room with good lighting. Get the Arixtra syringe, an alcohol prep pad, a cotton ball, and a biohazardous waste sharps container to put the syringe in. You must give yourself the injection in a different spot or site each time. This is called rotating the sites.
Wash hands for at least 20 seconds. Hand washing is the most basic thing you can do to prevent an infection. Wash your hands before and after the injection.
The following reviews hand washing procedures. 1. Wet hands and wrists under warm running water. 2. Apply liquid antibacterial soap and lather well. If you use bar soap, keep it separate for your own use. Rinse the bar soap before and after you use it to remove the lather.
3. Scrub hands and wrists for at least 20 seconds.
4. Pay special attention to fingers, fingernails, and the back of your hands. 5. Rinse hands well with your hands up. This keeps the dirty water running away from your hands. 6. Dry your hands using a clean paper towel, starting with the fingers and working down towards the elbows. 7. Use a clean, dry paper towel to turn off the faucet. Remember, you turned it on with dirty hands. Remove the syringe from the carton and check the following. The expiration date is not passed. The solution is clear, colorless, and has no particles. The syringe has not been opened or damaged. Sit or lie in a comfortable position so you can easily see the area where you will be injecting the medication. If you had total hip replacement surgery, you should administer Arixtra lying down. Select an area on the right or left side of your abdomen, away from your belly button and out toward the sides of your hips. These are sometimes called love handles. Clean the area you have selected for your injection with the alcohol prep pad. Allow the area to dry. While the area is drying, remove the needle shield by twisting it and then pulling it in a straight line away from the syringe. Discard the needle shield. To keep the needle sterile after you remove the needle shield, do not set it down or let the needle touch anything. Do not try to remove the air bubble in the syringe. It is normal to see a small air bubble in the syringe. Gently pinch the cleaned area of your abdomen to make a fold. Use your thumb and forefinger to make a fold in the skin. Be sure to hold the skin fold throughout the injection. Hold the syringe firmly by the finger grip. Insert the full length of the needle into the skin fold at a 90-degree angle. Inject all of the medication in the syringe by pressing down on the plunger as far as it goes. This will deliver all the medication into the fatty tissue of the abdomen. Be sure to hold the skin fold throughout the injection. Release the plunger and the needle will automatically withdraw from the skin and go back into the security sleeve and be locked permanently. After removing the needle, you can now release the skin fold. You can use a cotton ball to gently wipe the area. To avoid bruising, do not rub the area after completing the injection. Properly dispose of the used syringe. Place the used syringe in a biohazardous waste sharps container. Your town or state may have laws about disposing of these objects. Check with a member of your healthcare team for specific instructions. If asked by your healthcare provider to keep a log, record the date, time, and site of your injection. Precautions. Remember that Arixtra will make your blood clot slowly. This means longer bleeding if you injure yourself. Be careful as you walk and avoid bumps and falls. Also, be sure to always wear shoes or slippers to protect your feet. If you use knives when preparing food, be extra careful. Razors and hard toothbrushes can cause bleeding. Use an electric shaver and a soft toothbrush instead. Tell all your healthcare providers that you are taking Arixtra. If you have epidural anesthesia, spinal anesthesia, or a spinal puncture while taking Arixtra, you are at the risk of collecting blood in the spinal column, which could cause paralysis. Certain medications can increase the risk of bleeding. Do not take aspirin or any products containing aspirin while on Arixtra. Discuss with your healthcare provider any prescription and non-prescription medicines
vitamins, herbal supplements, blood thinners, and non-steroid anti-inflammatory drugs like Motrin, Naprosyn, or Aleve that you are taking. Do not miss any scheduled medical appointment or laboratory test you have. When to call. Some side effects of Arixtra are normal and others are serious and need medical attention. Normal side effects include minor bruises or small amounts of blood at the injection site. Serious side effects are rare but can still occur. Severe bleeding should be reported to your healthcare provider immediately. Signs of bleeding include spontaneous bruising, black or tarry stools, blood in urine, coughing up or vomiting blood, nosebleeds, bleeding gums, more bleeding than normal at the injection site. You should call your healthcare provider if you have an allergic reaction. Signs of allergic reaction include a rash, hives, and itching. Infections should be reported to your healthcare provider immediately. Signs of infection at the injection site include fever or chills, redness or swelling at the injection site, pain, skin is warm to the touch, drainage. Report a serious fall or hitting your head to the healthcare provider. You will need to be monitored for internal bleeding if you have such accidents. Report any other abnormal signs you experience, such as chest pain, shortness of breath, or irregular heartbeat. If you think that this is an emergency, go to the nearest hospital or call 911. If you become pregnant while taking Arixtra, call your healthcare provider.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Arixtra, or fondaparinux sodium, is a medication that helps prevent blood clots from forming or getting larger in the blood vessels. Arixtra is injected through shots in the fat layer under the skin. Your healthcare provider may have asked you to give yourself injections of Arixtra. These injections are safe. You need to communicate well with your healthcare provider. Tell your healthcare providers about all medications you are taking. As you start the Arixtra treatment, inform your healthcare provider about any signs of bleeding, infection, and other unusual symptoms. Your healthcare providers are available to teach you how to use Arixtra and to answer any questions you may have. Thank you for using Explain.